Just as we use the arms to test the function of the neck, to see if the person had good strength and range of motion, to see how the nerve levels were working, we need to use the legs, as I talked about, to check the function of the lower back. Why is that? Well, this is where you can see the effect of any nerve problems up here. So we'll check for strength. We'll look at the feet, we'll look at the legs. We want to see how easily and how far up he can bring this. On a healthy individual, and you don't have to be a gymnast, I'm talking about the average person, we should be able to passively bring the leg up about 90 degrees, which would be right about here. So he's coming up a little bit short here. That tells us that there's a lot of extra tension in the low back. Now this leg, a little further, it comes up easier. So we're checking for strength, we're checking to see how are the muscles working down here. So if we want to see how strong a certain nerve level is, I would have him bring his leg up like this and ask him to push up against my hand and push as hard as he can. That one's pretty good. Now we're going to check the other leg. Push up against my hand. That one's pretty good. So we're testing like a circuit here, like a circuit tester. We're testing specific muscles to make sure what levels in his back are working or are not working. Then we'll have them turn over and we'll test some other areas. We're always trying to determine what is the functional ability. The poorest gauge you can use to determine if you have a problem or not is whether or not you're having pain. Pain is like a bad house guest. It's one of the last ones to leave in any condition. It's the one you want to get rid of first, but it's the last one to leave. To get pain to go, you first have to get the function restored, strength and movement. So we're always checking to see how well do things move, do they work real good. In his case here, very poor rotation on the hip. His leg cannot come out very good this way. We're trying to look here and see how far off the table his knee comes. Very heavy, very stiff. So there's very poor movement across his lower back here. Again, in treating something like this, we'd bring in different therapies such as ultrasound, electrical stim, working with weights, stretch tubing, rehab ball. Trying to improve the posture curves is vital. In typical physical therapy, they don't spend a lot of time looking at the posture and the curves. As a chiropractor, and in our office in particular, we spend a high amount of time and energy on trying to restore posture curves. The focus of care is always to get you out of pain, but more importantly, to get you a better posture so you don't keep fighting the same problem over and over. It's very frustrating as a practitioner and for a patient to keep battling the same neck or low back problem 2, 3, 4, 5 times a year. Whereas if the person would put all that energy and time together in a little more longer treatment plan, they could probably tackle the issues that are really causing the problem. We'll also use specialized tools like an electrical adjuster. It's like a little jackhammer, a little tapper, and when we bring it up along the spine, it gently moves the joints to get movement through very locked and spasm muscle. This is also a very good tool to use for people who are afraid of the pop or click sound that you sometimes hear when we adjust their spine. It gets the movement in the joint. It's like a nice little impact wrench that like a mechanic would use on your car. Very gentle, very easy on children and older people. Another specialized tool that we'll use in low back pain or anywhere in the body is this instrument called a percussor. It has a very deep vibration, and what the head does is it goes up and down, but it also goes like this. So it really pumps the tissue, loosens up very tight and contracted fibers, and will come on the spine or the muscles over the spine with this, and it loosens it up very easily. People can just start to feel everything to relax and start to loosen up. Again, we'll bring in therapies such as laser therapy. When we shoot the laser on somebody here, it adds that energy to help the body have the energy to actually heal. It helps lengthen scar tissue, soften scar tissue. Laser therapy has actually been demonstrated to regenerate damaged or severed nerve tissue. So when it deals with nerve problems, compressed nerves from disc injuries and whatnot like that, the laser is very effective in getting the pain and inflammation down again, as well as restoring normal function. Again, we'll bring into play things such as the colored glasses, if we can use that on the people, and we start bringing their motion and movement back. and the pain starts to go away. So we're always looking at the short course of care, which is get you out of pain. The functional course is to get better movement back. We're going to bring all the tools that we have to bear on these issues for you to get your life and get your function back as soon as possible.